Welcome back, or welcome to Autoimmune Health Solutions. My name is Dr. Michael Smith, and I've been practicing traditional Chinese medicine and acupuncture for over 25 years, and I've also practiced functional medicine for just over 20 years. So I have a good sense of both the scientific model of acupuncture as well as the more traditional relationship with acupuncture. In this video, I'm going to speak to how acupuncture can help people with pain due to injuries and also chronic pain due to illness. To do that, we're going to have to take a deep dive into a little bit of the anatomy and the neurophysiology of what's going on during an acupuncture treatment. How specifically acupuncture helps with pain relief in the short term as well as in the long term. And how acupuncture can help with the natural process of tissue rehabilitation. I will begin with an overview of the different kinds of pain, the different causes of pain, as well as the consequences of experiencing long-term chronic pain. I also want to speak to the process or the sequence of how rehabilitation works and why sometimes that sequence needs to go through itself a few times, and specifically how acupuncture can speed up that sequence and how many times your body has to go through it to completely resolve an injury or chronic pain. And at the end of the video, if you stick around, I'm going to share with you a really great idea on how to get the most out of an acupuncture treatment or a massage or any other treatment that's focused on chronic pain. If you haven't seen the first video in this series, there's a link, and that video just speaks to the common sense of seeing an acupuncturist or another more root cause clinician on a regular basis if you have a chronic health concern. There's a big difference between people who are interested in solving the root cause of your illness and people who are focused on just managing your symptoms and managing your diagnosis. So let's talk about pain. There are actually many different kinds of pain. You can have acute pain or chronic pain. You can have stabbing pain, pulling pain, burning pain, freezing pain, throbbing pain, cramping pain, spreading pain, dull aching pain. Sometimes pain can stay in one place, or it can move around for reasons that don't seem to have any kind of common sense behind them. Pain can be due to many different things. Obviously, an injury will cause pain, inflammation can cause pain, certain infections can also cause pain. As well, chronic autoimmune inflammatory disorders often come with a lot of pain. Poor circulation in general, clotting blood, neurological damage, nerve compression due to disc degeneration, or even myofascial impingement can also cause a lot of pain. And there is also somatic constraint, which is something that happens when people have experienced a lot of trauma and they're still holding on to the memory of that particular incident or trauma, causing changes in circulation and mobility, and of course, creating more pain. One of the consequences of chronic pain that people don't often talk about is something that I call wounded animal syndrome. And this is based on many different layers of instinct. So it's something that's worth exploring, I think, and especially if you're a clinician or a person who's having a hard time having a good conversation with your clinician about what's going on. So I'll share with you a very common example or perhaps a case study. So in this moment, I'm thinking of a man I treated a few years ago. He was in his early 30s and he had damaged his back and had a compressed disc, and he couldn't work in the industry that he had been trained to work in. So he was laid off from work. He couldn't make a reasonable living. He was obviously in chronic pain. He couldn't get around very well. Being a young man, the fact that it was interfering with his sex life and the health of his marriage was a big stress in his life. He couldn't pick up and play with his children because of the injury. His outlook on his future was much darker because with that kind of mechanical injury, it didn't seem like there was a lot that he could do. So this wounded animal instinct that he had started to actually separate him from his wife, from his children, from his friends, because on a certain level, on an instinctual level, he didn't really feel like he belonged or fit in or deserved these connections in his life anymore, because on some level he felt that he was permanently broken and really in a way not really viable as a human being. And that's not something that I think most of us think about, but I see that very, very frequently in my practice when I'm working with people with, say, a chronic autoimmune condition that doesn't have, at least in Western medicine's perspective, any kind of long-term positive outcome. And that's very depressing. It's very heavy on the heart and soul, and it changes how we actually think of ourselves in the world. Imagine having chronic pain when you're not sleeping very well. You're having problems doing pretty much everything that you enjoy. Again, that's such a self-limiting experience and such a separation from your body, because when you lose trust and hope with your body, there's really not much else to do than to numb out. And that's what a lot of people end up doing. And that's one of the main reasons why we have an opioid crisis, because once you start down that road of just turning yourself off instead of finding your best possible choice to turn your life back on, you can end up in there for many, many years. And I've seen that happen. So again, as an acupuncturist, it's one of my passions to help people to get off of those medications that are fundamentally just very addictive and only meant to be used in the very short term. So anyone with this wounded animal instinctual response is also going to be generating a lot more stress hormones, which typically tilts most people in the long term towards a chronic disease. So like that young man I was speaking about, luckily we solved his back problem within a few short months. If he had not sought out those treatments, the long-term stress of that wounded animal syndrome could have propelled him into some kind of chronic illness. So that's a win for him, because he got his health back, his mobility back, and avoided the long-term consequences of a chronic illness. So let's take a moment and look at how tissue rehabilitation actually works. And especially from the perspective of an injury, there's 5 stages. The first of the 5 stages is called resolving hypertonicity, which is a pretty fancy way of saying relieving a muscle that's just cramping up or trying to protect itself. The second stage is to improve range of motion or flexibility. So if I have an injury and I'm in a lot of pain and my body's kind of limping, in order for me to get to the next stage of therapy, I have to get those muscles that are tight or hypertonic to get loose or to relax a little bit, so that I can get my range of motion going back to normal. Because the third stage is to actually get your biomechanics back to normal. So again, if I'm walking around like this, that's not normal biomechanics. I have to relax the muscles, get the range of motion going, and then find myself with my shoulder in the right place, so that stage 3, proper biomechanics, I can move into stage 4, which is to begin to strengthen the tissue around the joint. And then stage 5 is to create more endurance in that tissue. So if I can get rid of the cramping muscle, get the joint back into proper mobility, get the bones in the right place so that the structure works properly, and then strengthen and then work on the endurance, that would be considered a completely recovered joint or rehabilitated injury. So let's look at those 5 stages in more detail, and specifically with respect to how acupuncture can help that happen. So let's use another case study. So I'm thinking of a person that I treated, and it was quite a stubborn situation. The person was into windsurfing, and they had a big gust of wind had come along and had almost dislocated their shoulder by pulling their arm, almost out of its socket. And that tore a lot of the muscles and connective tissue inside the rotator cuff, or the muscles that operate how your shoulder moves around on the inside. So that's a very challenging kind of injury to work on, because there's so many different muscles going in so many different directions. So when this person first came in, it was a few weeks after the injury, and they had just been using some painkillers and anti-inflammatories, and they were beginning to get more and more restricted motion, and we were both afraid they were going to end up with what is called a frozen shoulder. So we were both very focused on getting this situation to improve. So what we had to do from a stage 1 perspective is to resolve the hypertonicity, or get all those tight protective muscles to relax. Now, an important thing to be aware of is that some of the muscles that are tight around an injured shoulder, regardless of what the injury is, some of those tight muscles are actually damaged. And some, if not many other muscles, are actually recruited into what is called a splinting response or a limping response. So let's say there's 7 major muscles in your shoulder that could be injured from that kind of strain when you're windsurfing. So some of those muscles are going to actually be injured mechanically, and some of those tight muscles are going to be recruited, which means they're not in dysfunction, they're just trying to help their friend out. And you have to be a fairly savvy clinician to be able to make the distinction between which muscles are actually damaged and which ones are just recruited. So if we were to look at a muscle from an anatomy book, there are actually 4 different places that most acupuncturists focus on when we're trying to get muscles to relax. So the first thing is called a motor plate, and it's actually in the middle of the body of the muscle. So if this is my bicep, and there's tendons from here to my elbow and tendons from here into my shoulder, the belly of the muscle is only actually this big. So if the nerve is kind of like the spark that makes the muscle move, it makes the most sense to have the nerve right in the middle of that muscle so that the conduction goes equally from the motor plate to the rest of the muscle, contracting that muscle evenly and the most efficiently. So that's one of the places that acupuncturists focus on, because it's the nerve that keeps the muscle hypertonic if it's injured or if it's just recruited. Another important place are what are called myofascial trigger points. They're a bit more complicated, and they actually have more to do with how the body is trying to relax and then feels some scar tissue or some strain or sprain in the tissue, realizes it's not safe to keep relaxing because it'll cause more damage, and that holds more constraint in the tissue. And trigger points have been studied for decades, and they're very, very well understood. And in fact, about 80% of the traditional acupuncture points are actually known to be trigger points. Another structure in your muscles that acupuncturists often are looking for to see if they need treatment are in what is called the aponeurosis. Now, that's the place where the muscle as a structure meets the tendon that it's attached to or turns into before it actually attaches to the bone. So that's another place where your body's always getting a sense of how strong the muscle is, how much integrity it has, and how much load it can take. So if you're a weightlifter and you're picking up a really, really heavy weight, it's actually that nerve-muscle connection that tells you whether or not you should actually continue lifting that up or not, or whether the weight might actually rupture the strength of your muscle and tear it apart. The fourth structure is called a Golgi tendon organ, and that's actually mostly around where the tendon attaches to the bone. And those little structures are very, very small, but they're also there to sense whether or not you're doing something that's likely to make the muscle rip off of the bone, which actually can happen. So those are 4 places that acupuncturists are always checking in treatment of injuries to see if they're hyper excited. Because if those nerves are really excited, they're sending confusing messages to that muscle, the muscles around that muscle, to your brain, telling you whether or not you should try and pick up anything at all. Now, another thing that happens to each of those kinds of trigger points is called an inflammatory capsule. And this is the way the body keeps a muscle tight or protected in the long term, especially with chronic illness, where the whole body is often inflamed. So these little inflammatory capsules sit where the nerve and muscle connect, and the inflammatory molecules or hormones actually tell the body through that nerve that you're injured. So the opportunity that creates, strangely enough, is if you take your acupuncture needle and actually kind of pop that little inflammatory capsule, it pops open. The inflammatory metabolites and hormones leave that capsule, and then that nerve and muscle are no longer living in an environment where they're being told there's chronic damage or danger or injury. So in stage 2, with our friend who injured their shoulder windsurfing. So we've done a few acupuncture treatments to get the muscles to stop being in an argument with the body and with each other. And then that person starts to work on flexibility. Now, when you start doing that, you're pulling on muscles that up until recently were injured. And I had those inflammatory capsules. And now that we're working on that range of motion and stretching out those muscles, what often happens is the body says, I'm not ready to do that. So it starts creating more recruitment to protect the muscles as they gradually, step by step, start to go back to normal length. So that's why acupuncture is so effective, because as you're releasing the damaged muscle and the recruited muscle, and things start to move around and the body gets a bit nervous or shy, and you keep relaxing those muscles that are doing a very instinctual thing, the time it takes to get a person back into normal range of motion and normal biomechanics is actually a lot shorter. So when a person goes into stage 4 to strengthen the body, depending on the integrity of those muscles, the way they're strengthening their body, how good their postural biomechanics are, acupuncture may or may not still be necessary. It often is at the beginning. And for some people who have severe chronic, say degenerative diseases, we actually use electrical stimulation to help strengthen the muscle and tone it before the person starts doing anything more challenging, like say lifting weights or doing any kind of body weight centered exercise. When it comes to stage 5 and the building of endurance, Another way that acupuncture actually helps the body repair itself is through the release of stem cells, which the body actually keeps stored in that fascia around the muscle. So if a person's trying to get stronger, they're trying to get the endurance, they're trying to keep their good mechanics going, having that active stimulation of circulation and stem cells helps the muscle get stronger, build more capacity where it connects to the bones, and of course become a natural, healthy and strong and fit muscle in the sense of endurance. So that's a kind of quick drive-by explanation of how acupuncture helps with those 5 stages of rehabilitation. And again, as you release that first stage and second stage and start to work on getting your biomechanics back to normal, sometimes you have to go through that first 3 stages 2 or 3 times as the body kind of shyly resets its normal movement until you get back to stage 4 where you're actually in a good enough biomechanical situation to start strengthening your body.